we are going to look at the kidney stones. Kidney stones, and we're going to look at how they are managed. So to begin with, we'll ask some questions. So the first question we want to ask is, how is the renal calculi managed? So we'll find out this answer in this video and learn in detail. So first, the kidney stones is a broad term. So in kidney stones, there are two varieties need to be known. One is the renal calculi. Other variety is nothing but the ureteric calculi. So now we'll be looking at the renal calculi. So under renal calculi, there is less than 0.5, less than equal to 0.5 centimeters. So in this case, what we do is the conservative management is what is done. Then when we look at the 0.62 centimeters to the 1.5 centimeter. So in such situation, we have the ESWL. So the ESWL, it stands for the extra corporeal shock wave lithotripsy. So this is done, ESWL. Next, what we see is there is so as soon as the ESWL is done, then we look for if the CI or fails. If or fails, so in this situation, we go for the URS. So URS is nothing but the uteroscopic retrieval of stones. So the URS is done, and once the URS is done, on the other hand, there are two things. One is the URS is done, other one you do the PCNL. So what is this PCNL? PCNL is nothing but the percutaneous nephrolithotomy. So these two are done. So now when the URS and the PCNL, so when you look at the URS and the PCNL, so when these two fails, what happens? When these two fails, there is the open or the laparoscopic. There is open or laparoscopic phylolithotomy, as well as there is the nephrolithotomy. So we discussed about the masses being less than 0.5 centimeters, 0.6 centimeters to 1.5, and now we are going to look at greater than 2 centimeters. So in case it is greater than 2 centimeters, we directly go to the PCNL. What is this PCNL? The PCNL we discussed was, it is nothing but the percutaneous nephrolithotomy. So after this percutaneous nephrolithotomy, so again we go to the same cycle, that is we check if it is failing. If fails, so if fails, we go again move on to the open or the laparoscopic pyelolithotomy or the nephrolithotomy. So now we are going to look at the uteric calculi, management of the ureteric calculi. So under this, the first step will be to check if it's the size. If the size is less than 0.5 centimeters, we do a conservative to management. And in case it is greater than 0.6 centimeters. So in such situation, we look for the non-impacted. So in case it is non-impacted, we do the URS. So what is this URS? URS is the uteroscopic retrieval. Uteroscopic retrieval of the stones. So this is done. Next, if the URS it fails, so we assume it fails. So in case the URS fails, then we move on to the uterolithotomy. Then we move to the uterolithotomy. And another scenario is when it is greater than 0.6 centimeters, we directly go the impacted and the ureterolithotomy is done. Now to answer our questions, the first question we asked was how to manage the renal calculi. So just to summarize the renal calculi, we saw there are three headings, that is one is less than 0.5, other one was 0.6 centimeters to the 1.5 centimeters, and the next category was greater than 2 centimeters. So in case of 0.5, we need to know it is a conservative management, and 0.6 to 1.5, what we need to know is the ESWL. So we already know the full form, that is a extracorporeal shockwave lithotripsy. So in case if this fails, what we do is we move on to the URS. What is URS? URS stands for the uteroscopic retrieval of stones. Or we also move to the PCNL. What is PCNL? That is a percutaneous nephrolithotomy. So the first step we need to know is the ESWL. So when these two fails, when URS and PNL, the percutaneous nephrolithotomy, it fails, then we move on to the open or the laparoscopic pyelolithotomy. So once this is done, then we look for we do the nephrolithotomy. So this was the step. So in case the PCNL, so in case the renal stones is greater than 2 centimeters, you directly go for the PCNL. That is the percutaneous nephrolithotomy.